As a head and neck surgeon, I see all manner of neck lumps, and common things being common, most things are benign. So we classify neck lumps really into things that are not serious, or benign lumps, or they can be malignant and be coming from the big C, which is actually very rare. So common causes for lumps are actually things like infections, inflammation in your body. They can be due to things within your skin, such as like a simple sebaceous cyst or a lipoma, and actually very rarely some cancers can present with neck lumps. When you mention things like lifestyle, traditionally smokers and drinkers got head and neck cancers, so cancers into the voice box or the back of the throat, and they can actually commonly present with a lump in the neck. More and more in young people, there are actually certain viruses such as the HPV or the human papillomavirus, which is also associated with cancers, so that's another lifestyle factor that's associated with neck lumps. If you have a new neck lump that's been there for more than 3 weeks, that needs investigation to make sure it's not the big C. Now that's usually associated with stratifying patients as well into the older age group, which is more than 40. And if they have other symptoms associated with like a sore throat, which might be one-sided, we call that unilateral sore throat, changes in their voice, changes in their swallowing, and a new neck lump, then that constitutes investigation to make sure it's not a cancer. If you've got a new neck lump, which feels quite warm and it's associated with you being actually constitutionally unwell with a high fever, there's redness over that lump, you should present to an A&E department or see an ENT specialist in case you've got an abscess. We're able to look at neck lumps to see what they are, and we actually have to look at the architecture to make sure we can then classify them into either benign or malignant. So the first diagnostic test we usually do is an ultrasound scan. So it's a dedicated ultrasound scan performed by a head and neck radiologist, and they would actually look at the architecture of the lump that they found. They will then decide whether that is benign, and if they're happy that it's benign on the features that they can see in the ultrasound, then nothing else is indicated. If it's suspicious, or if they think it's definitely malignant, they would perform a fine needle aspiration or an FNA on the same day. So if we then think a neck lump is suspicious in any way and a biopsy has been performed, we'll then go on to probably do an MRI or a CT scan of the head and neck area as well. We've got a dedicated treatment room, so if the neck lump is then diagnosed to be benign, something like a sebaceous cyst or a small lipoma, that can actually be taken out or excised under a local anaesthetic. So the patient would then be counselled to have that procedure done, take informed consent, and we'd be able to perform that in the treatment room. So that would involve freezing up the area with a local anaesthetic and performing a small surgery, which can be on the same day, to have that removed and then following up the patient at LycaHealth.